Good evening, everyone. All right. Hi, everyone who's joining. All right. All right. Hi, everyone who's joining. All right. Sorry, it's taken me a bit of time to set up. I'm trying to see everyone who's joining. We're going to wait for 2 to 3 minutes while people join in. In the meantime, in the comments, please write where you're from, what your profession is, and if you're taking the exam anytime soon, please mention your exam date as well. So while students are joining in, let me introduce myself. My name is Gurleen Khaira. I'm the course leader at Khaira Education. We are Asia's first premium preparation provider. What this term means is that we have an endorsement by the OET Center Australia, and we're listed on OET.com as a recommended training provider. We have online and offline classes available. Our offline presence is in 3 cities in North India, in Mohali, Amritsar, and New Delhi. And online, we offer classes. We've trained students from over 16 countries. I've designed the course myself. I've written 7 books till now, including 4 official OET textbooks. And we have presence on Instagram, Facebook, and YouTube, where we keep sharing mini lessons and free study tips and free resources for OET preparation. Currently, we are training 4 professions for OET, which will include nursing, medicine, physiotherapy, and pharmacy. And if you're preparing for OET, please follow us on Instagram. Please follow our YouTube page. You'll find the resources, the lessons there very, very helpful. If you want to reach out to us to inquire about our courses, you can reach out to us on WhatsApp. The number is displayed on the screen. This is the topic for today's class. 5 ways to enable accurate and efficient information gathering. This is for OET speaking. Now, as health professionals, when you get your role play card, if you see the words ask or find out or inquire, that means you're supposed to gather information from the patient. It could be about their symptoms, it could be about their medical history. So whatever you need to ask, that will be mentioned on the role play card itself. But if you see these verbs, find out or ask or inquire, so that is the clue that you need to gather information. And we're going to discuss 5 techniques how you can do this effectively. So the first technique that we will discuss is using the right approach, the right order of questions, which is commonly called as the cone technique. So the continuum of open to closed questioning, we'll discuss the type of questions and in what order they should be used in a role play. The second would be eliciting the patient's perspective, probing into what the patient's ideas, their perception about the illnesses, or if they have any expectations from you that need to be addressed in the consultation. The third would be facilitating the patient's narrative with active listening techniques. So facilitating means just making something easy. And narrative here means the details that the patient is going to share with you. So how you can make your patient feel comfortable so that they can talk freely with you. Those are the techniques that we will discuss in this aspect. The fourth one would be clarifying statements that are vague or that need amplification. By amplification, I mean that need to be elaborated on. Suppose there is ambiguity or something is unclear. So you can use statements to clarify the meaning and to check for accuracy. That's what we'll discuss in this. And summarizing information to check for accuracy. This is to be used at the end of the information gathering stage to ensure that whatever you've understood is accurate and there's nothing that you've missed asking the patient, or there's nothing that the patient hasn't been able to share with you. So these are the 5 techniques that we would discuss. At the end of the class, I'll also share some helpful tips that will enhance your information gathering. It will obviously make it more effective. And I have included lots of language examples for all these techniques, because as students, I know that you would want an example or some sample phrases that give you an idea of how it is to be applied in a role play situation. So I've included lots of examples, lots of phrases that you can recycle and use. Obviously, it goes without saying that you will need to adapt it to your role play context. Also, please don't worry about making a note of it. At the end of the class, I will share a link from where you can download these. You can download this entire presentation. So in the class, just focus on the activities that we're going to do. And if any questions come to mind, please keep typing it in the chat box. All right, so first technique, the continuum from open to closed questioning, or the cone technique. So before we delve into that, I want to start by discussing what open and closed questions are. So open questioning technique. So there's a deliberate reason why I've used the word technique here. I haven't used the word open questions. I've used open questioning technique because when you want to start the role play, you would want to use questions or statements that encourage the patients to respond to your question in their own words, in an elaborative manner. So for example, what brings you here today? Or what can I do for you today? Tell me what has been going on. Tell me what has been going on is not a question. It's a directive statement. So whenever you start a role play, Start with an open question or a directive statement that allows the patients to respond or share whatever their problem is, whatever their symptoms are, in their own words. You see some examples on this screen. This is a good one. Start at the beginning and take me through what's been happening. Or please tell me what has been going on. So these are examples of open questions or open directive statements. In contrast, we have closed questioning technique. Now, closed questions require a 1 or 2 word response. For example, are you allergic to any medications? This can either be answered in a yes or a no. So while open questions will elicit a response that is going to be quite elaborate, closed questions only require a one or 2 word answer, a short response. Now, both these question types, they achieve very different outcomes, but both are important in OET speaking and in your day-to-day practice as well. It's not that you would prefer one over the other, but yeah, there has to be a sequence in which they are to be used, which we're going to discuss. So these are some examples of closed questions. For example, have you experienced any pain in the last 24 hours? Or if this is to be adapted to a context where the patient is, let's say, suffering from some other symptoms. So instead of the word pain, you can use that. You can use that word. So whatever example you're seeing here, don't memorize it as it is. This will need to be adapted to the role play context that you have. Have you had any surgery before? Are you a vegetarian? Do you smoke? So these are questions, closed questions that would elicit a 1 or 2 word response. Now, how do we use open and closed questions in an OET role play? We use something called the cone technique. You see an ice cream cone on the screen. I hope this will help you remember in what sequence the questions have to be used. You start off with open questions, and then you move down to closed questions. So the cone, it denotes that it's open at the end, and then it sort of tapers down. So this is the technique that we would use in OET speaking as well. You will start with open questions and appropriately move to closed questions. Now we come to an activity. In the left-hand column, you will see a dialogue between a doctor and a patient named John. And the doctor has used open questions at the start, going down to closed questions. In the right-hand column, open and closed questions are used, but in a very random order. I would like you to first read both, and they are for the same medical context. I would like you to read both the dialogues and then tell me which technique or which one of these dialogues has generated information that you need as a health professional in a more suitable manner. I'll give you about 2 minutes to read this. Okay, Estrella says the first one. Estrella, why do you think the first technique is more appropriate? Okay, Lara, Could you also give me a rationale? Why do you think the first technique is more appropriate than the second one? Patient is able to express thoughts and emotions surrounding the symptoms. Good. First one, okay. Seems like everyone agrees that the first technique is more appropriate. See, in the first technique, cone technique has been used. The health professional starts with an open directive statement that I'd like you to tell me in your own words what's been happening. Then the second question that the health professional uses to probe further is also an open question. Can you tell me more about it, please? And then the patient freely shares whatever has been going on, right? Then gradually, then the health professional elicits patient's ideas on what might be causing the chest pain. And here, patient reveals that he's got a family history of heart attack, which might be relevant when probing chest pain. Whereas if you see the second role play, in that this information is not being elicited because closed question is used to start. Most of them are closed question that the health professional uses. What happens when a health professional only relies on closed questioning technique is that some relevant information that is needed for an accurate diagnosis can be missed. That is why whenever you are gathering history from a patient, always use the cone technique, which would mean you start with open questions and then you start using closed questions to probe relevant symptoms or relevant information. Of course, closed questions would also be used. I've just used a part of the conversation, right? Gradually, in the first conversation as well, the health professional would eventually move on to closed questions to probe what is the severity of pain, what is the intensity of pain, whether it gets better, or other relevant questions. But what we are discussing here is the order in which open and closed questions are to be used. So from open to closed, that is the technique. And if you need help remembering it, just think of an ice cream cone and you start with the open and then move on to the closed. There are some questions which should not be used when you are gathering information, and let's discuss those now. First type of question that you should not use when you're gathering information are leading questions. Leading questions are those that have an answer assumption in the question itself. And why it shouldn't be used? Because that answer assumption in your question can somehow, even if it's unintentional or inadvertent, it can influence the patient's response. So see this example. You're not experiencing any chest pain, are you? In this, there is an answer assumption already. The patient is suffering from chest pain. There is a suggestion. So avoid any leading question. Always ask open questions. It's better that whatever symptom the patient wants to share, whatever answer, it should come from them. Your question should not have an answer suggestion. And then compound questions, or they're also called multiple questions. Multiple questions are two or more questions asked at the same time. So for example, do you drink or smoke? This is a compound or a multiple question because it's asking two separate questions in a single go. So you should avoid any leading questions or multiple questions when you're gathering history from the patient. Before we move on to the next activity, I'd just like to check, are there any questions till this stage? All right, good. Now I have an activity for you. I'm going to show you some questions on the screen, and what you need to do is decide if that question is appropriate or not. And if it is inappropriate, then you need to transform it to make it suitable. We'll first discuss an example together. For example, is the pain sharp? Now, this is an inappropriate question. Why is this unsuitable? Because it's a leading question. It already has an answer suggestion that the pain is sharp. So how can this be transformed to make it suitable? How would you describe the pain you're experiencing? This is an open question, but it does not have any assumption or an answer suggestion in it. So we transform the leading question to an open question to make it suitable. Now let's see this question. Do you have any pain at the moment? Is this a suitable question? So this question, do you have any pain at the moment? Is this a suitable question? Is this appropriate? So when we're gathering information from the patient, should we be asking this while gathering information? Do you have any pain at the moment? How can we transform this? Suppose this is one of the first few questions you have to ask when a patient presents to you. Think of it as a question that you need to use in the initial stages of the consultation. Okay, do you have any discomfort? Good. This would be better. How are you feeling right now? Or do you have any discomfort at the moment? Rather than a question which has an assumption that the patient is in pain, I think it would be better to probe how they're feeling at the moment. That is better. How are you feeling right now? Then look at the second question. Has this made you worried? Is this a suitable question? No. And how can we transform this? How do you feel about this? Lovely. Yes, Kupive, that's a good answer. How do you feel about this? So what are your thoughts and emotions about this situation? So has this made you worried? It's a leading question. Rather than suggesting or assuming the patient is worried, it would be better if you ask an open-ended question to probe how they're feeling. That how do you feel about this? Or how do you feel at the moment? What are your current thoughts? What are your emotions about this? Then the next one, can you tell me more about your fatigue? When do you usually feel tired? Is this appropriate? Can we use two questions in a single sentence or in a single go? Would it be appropriate to do this? So what we see on the screen is an example of multiple question or compound question. So what we need to do is break down this question into two separate ones. First, it's better to ask, can you tell me more about your fatigue? Wait for the patient to respond and then move on to the second question. All right, now before moving on to the next technique, I would like to ask if there are any questions about using the cone technique. Are you clear about what open and closed questions are and what the cone technique is? Let me just go through the comments quickly and see if there are any questions I can answer. Okay, Estrella, that's a good question. So in the exams, questions that answered by yes or no are not acceptable. No, Estrella, that's not true. Like I said, both open and closed questions, they achieve different outcomes. So closed questions, which would require a yes or no response from the patient, are also important. But at what stage you use open and closed questions, that is of relevance here. That is what we were trying to discuss. When you start gathering information from the patient in the initial part of information gathering, that is when you should start off with open questions. At that stage, using closed questions that would elicit a yes or no response from the patient could probably lead to some information being missed out. So you should start off with open questions that allow the patient to talk as much as they can to share information that you decide whether or not is relevant to be explored from a biomedical perspective. And gradually, once you understand what the medical issue is, what information is relevant to be probed into, that's when you start using closed question to explore it further, to delve deeply into it. Joy, at what point do we stop asking open-ended questions and move to closed? So, Joy, this is something that you decide as a health professional. Initially, I think 2 to 3 open questions are suitable, and gradually your approach becomes more and more focused. So once the patient shares how they have been feeling, what their symptoms have been, and what their ideas about the illness or their symptoms are, then you can start focusing your questions. Then your approach starts becoming narrower and more focused. That's when you can start using closed questions to probe into the area that you feel is medically relevant to get onto a diagnosis. All right. If there are no other questions, let's move on to the second technique, which is eliciting the patient's perspective. And we're going to discuss 3 techniques here, 3 sub-techniques. One is about exploring the patient's ideas or beliefs. Second is about eliciting the patient's concerns. And the third one is patient's expectations. Now, this is quite important, and I see that students preparing for OET commonly overlook this aspect. But this is very important for OET as well as your real life. Number one, I feel that if you do this, if you incorporate this into your questioning technique, this would improve the trust and rapport with your patient. And if you do that, as a consequence, obviously the patient would be more comfortable sharing their thoughts, their ideas with you. If they're comfortable, perhaps with the discussion, you can reach or devise a treatment plan or their plan of care that would be acceptable to them. And of course, the adherence would be better. And I also think that in multicultural environments, to be culturally competent as a health professional, I think it's important that you explore the ideas or the expectations early on. Because sometimes what happens is that people might have religious or cultural beliefs that could interfere with the treatment plan or be in conflict with the treatment plan. So if this is explored early on, perhaps consensus can be reached. So, which is why I feel that this is an important aspect that needs to be looked into. So let's start with the first one. Patients' ideas about their perception of illness. What they feel, what patients feel might be causing the illness or the symptoms. So some questions that you can use, some language examples that you can use when you're probing into this is, tell me about what you think is causing it. Or what do you think might be happening? Or you've obviously given this some thought. It'll help me to understand, or it'll help me to know what you think it might be. So if the patient has some perception or some idea about what might be causing their symptoms or medical condition, they can share their thoughts with you. And the second is eliciting patients' concerns. So some questions that can be used to probe this are like, what are you concerned it might be? Or is there anything specific that you're concerned about? And if the patient shares their concerns with you, always reassure the patient. So some examples, I understand your concern and we'll do everything to address this. Or I want you to know that we're here to support you through the process. Then to probe expectations, you could ask something like, what were you hoping to discuss during your visit today? Or what are your expectations from today's consultation or today's meet? Or once the agenda has been established, you could even probe that, is there any other issue that you'd like me to address? Now, of course, it's not, sometimes due to paucity of time, if you're pressed for time, may not be possible for you to address a lot of issues, right? But then there's a tactful way to handle that. But always it's a good idea to probe what your patient's expectations are from that consultation. Okay, we have an activity now. So you see a dialogue on the screen between a health professional and a patient named Sarah. Please read this and then identify an example of how the health professional elicits the patient's ideas. There's one example where the health professional elicits or probes about the patient's ideas, their thoughts about what might be causing their symptoms. So please identify that example and type it. Good, Samanya, that's correct. So see this example here in the last sentence. Can you tell me more about what you think is causing your knee pain? This is an example of how the health professional probes into what the patient's ideas about their condition are. So when you are gathering information from the patient, do check if they have their own perception of their illness, about what might be causing their symptoms or illness. Then let's go to the next activity. Again, there's a dialogue between a health professional and a 45-year-old patient, John. And you can read this and then identify an example of how the health professional elicits the patient's concerns. Good, Estrella, that's correct. Very good, Kupive. Yes, can you tell me more about how you're feeling? Yes, yes. So can you tell me how you're feeling? And even this question, can you tell me more about what's been going on? So this is the health professional trying to understand what the patient is concerned about. This particularly, this question here, can you tell me more about how you're feeling? This is exploring the patient's concerns. If you see the sentence preceding it, sounds like you're concerned and how it's affecting your health. Can you tell me how you're feeling? So this is precisely asking what the patient's concerns about their medical condition are. And I'd also like to take a moment to highlight how the health professional responds to the concerns. So like we were discussing, whenever patient shares their concerns with you, it's important to reassure them. It's important to empathize and reassure. Helps to build up rapport with your patient, right? So see how the patient is reassured. It's normal to feel anxious when you're dealing with health issues. Now, this is an example of validating statement or a normalizing statement. This is a technique that can be used to reassure patients. So it's normal to feel this way. It's a reasonable reaction. This is how you can reassure your patients. When they share their concerns with you, always tell them it's normal. This is how you should acknowledge their feelings. All right, and then the final activity in this section, again, a dialogue between a patient and a health professional. And this time you need to identify an example of how the health professional elicits the patient's expectation from this consultation. Very good, Manju. Lovely, lovely choice. Great, great. These are, yes. So see, first, if you see here, can you tell me what you're hoping to achieve during this appointment today? You're checking your patient's expectations, what they expect from this consult today. And even this example here, if you see this, is there anything else that you're concerned about or you'd like us to address today? This is also an attempt to probe into the patient's expectations. So you don't need to do it twice, but I mean, this is just a dialogue that I drafted to give you clarity about the concept. Just once is enough. So see a quick recap of what we've discussed in this section. You need to check or probe into the patient's perspective, which would include 3 different aspects. The first aspect is exploring their ideas. Ideas is what the patient thinks from the patient's perspective, what might be causing their symptoms or condition. Second one is probing into their concerns. If they have any concerns, you can directly ask that, are there any concerns that you have? Are you particularly concerned about something? And then the third one is checking their expectation from the consultation. So these are the 3 things that you must incorporate when you're gathering information from the patient. Before we move on to the next section, are there any questions about what we've discussed till now? So Estrella, you can do this at the beginning of the consultation once you've probed into what the visit purpose is or what the patient is seeing you for. At that stage, when you're trying to set the agenda, that would be a good time to check the patient's expectations. Okay, then we come to the third technique, which is facilitating the patient's narrative with active listening techniques. We're going to discuss 4 active listening techniques that would make your patient feel more comfortable, and it would encourage them to open up and talk freely about how they're feeling, about what they're going through. First active listening technique that I want to talk about is empathy. So empathizing is the ability to understand and share the feelings of another person. So it involves putting yourself in the other person's shoes and imagining what it must be like to be in their situation. This can help you better understand their perspective and show them that you care. When you verbalize this feeling, that you understand how they are feeling, that is empathy. For example, let's say you're a healthcare provider and you're seeing a patient who has been experiencing chronic pain. And imagine that when you ask the patient about their pain, they respond with frustration and anger, saying something like, it's always there, no matter what I do, it's just ruining my life and I can't take it anymore. Now, how would you respond with empathy in this situation? Let's see an example. I can see how this is affecting you. It sounds incredibly frustrating to deal with this day in and day out, especially when it's interfering with your daily life. So what the health professional is trying to do here in this example is conveying an understanding. This conveys that you understand how difficult it is for the patient to bear whatever they're going through, right? So conveying that you understand the patient's discomfort or the distress, that is empathy. And why is it important? Because when you acknowledge the patient's feelings and show that you understand how difficult the situation is for them, not just the pain, like situation, you're creating a safe space for the patient to share more information. So the patient will obviously feel more comfortable, the trust will improve, and they'll open up more. And of course, eventually this is going to lead to improved patient outcomes. So there are some examples here. You don't need to note them down. We're going to give away a handout of these slides to you. But these are just some examples that could be used to empathize with your patient. For example, see, I know this can be overwhelming, but you're not alone. We're going to help you through this. Or it's completely understandable that you're feeling frustrated. And see, these are just general examples. You will need to adapt these to the role play context. So for example, if a patient is anxious, then you could say it's completely understandable that you're anxious about your condition. So these phrases are to be used as a guide. Don't memorize them as it is. See how empathy is being conveyed through these phrases. And of course, you will need to adapt them to each role play card because every situation is unique. I'm so sorry that you're experiencing this, and then substitute it with the word or the emotion that the patient is going through. Must be very difficult for you. It must be challenging for you. After empathy, the second active technique that I want to discuss is back channeling, or we can also call it facilitation. This refers to verbal or non-verbal cues that indicate that you are actively listening to the patient, that you're involved in the consultation, that you're engaged in the conversation. So some examples are emphatic expressions that don't carry any meaning, but you use them just to convey that you're listening to the patient. So terms like, all right, go on, yes, These are examples of how you can convey that you are listening to when the patient is talking. Now, something that you should remember is you don't have to talk over the patient. So if there is like a pause in between, or you want to signal to the patient that you are listening to them and you want them to go on or continue talking, very tactfully, that is where it's to be used. So for example, if a patient is talking to you, takes a slight pause, you can say, I see, go on. So these words don't carry any meaning. These expressions are just to show that you're listening, encourages the patient to keep talking. Then the third active listening technique is called mirroring. This means repeating keywords or the last few spoken words with a rising intonation that acts as a prompt for the patient to continue talking. Now, whenever you are speaking to the patient, they are generally eager to tell, or they give you cues about how they're feeling about something. So for example, if a patient says, I'm feeling quite overwhelmed, and you want to probe more into that, you want to explore that particular emotion more, like what is making them feel overwhelmed, right? And you want them to talk more about this. So what you can do in mirroring is repeat the keyword here being overwhelmed, the area that you want to probe. Repeat that with a rising intonation, and intonation here is just raising your pitch. So overwhelmed. This is an example of how I've used rising intonation. And when you do this, this signals to the patient that you want them to talk more about why they are feeling overwhelmed or what they're feeling. So mirroring is repeating the exact words of the patient in a rising intonation, whatever you want to probe. So another example could be the patient says, I feel that everything is black, and you want them to talk more about why they are feeling like that. So you could say black. So when I just even use this with the rising intonation, it would be an indication for the patient to talk more about what they mean by that expression. So see, in the technique of mirroring, you use or you lift the keywords used by the patient, and then you just make it sound like a question that, okay, talk more about this. And there's a twin skill that we have of mirroring that's called reflection, in which you use your own words to reflect on the emotion. So see the example on the screen. The patient says, I don't feel like it's making any difference and I'm tired of all the side effects. Now, if I had to use mirroring here, and I want to know more about why the patient feels that it's not making any difference. So if I had to use mirroring, I can use the same words that the patient uses. So I could say, not making any difference, right? But if I have to reflect on it, reflection would mean I use my own words to convey my understanding and then ask them to confirm whether or not what I've understood is correct and encourage them to talk more. So like how we can use reflection for this example, it sounds like you're feeling discouraged about your treatment and the impact it's having. Is that right? So in reflection, you basically share your interpretation of how they are feeling. And it's a good skill, it's a good technique to probe or to encourage your patients to talk more, especially if your patient is not forthcoming with the information, if they're reluctant to talk, they're not talking much, then you could use mirroring or reflection. Any questions about these 4 active listening techniques? That very good, Era. That's a good example. It sounds like you're not satisfied with the treatment. So that's another way we can use reflection for the same example that we have for screen. So any questions about these 4 active listening techniques that we've discussed? Empathy, back channeling, mirroring, and reflecting. Okay, then let's go to the activities. Now, this is the first exercise for you. If a patient says that I'm not sure if I'm explaining this clearly or making any sense to you, how can you respond empathetically to this? How will you respond to this patient in an empathetic manner? Very good, Eliza. Good response, Manju. Good, Sundari. Good examples. Just one answer suggestion. Of course, there would be several ways that this can be responded to in an empathetic manner. But one of the examples is there on the screen. So it can be challenging to put medical issues into words, but you're doing a great job explaining yourself. I'm here to listen and help you. Can you tell me more about what you're experiencing? So in this example, the health professional has empathized, validated the patient's feelings, reassured the patient, and then again, ask an open-ended question so that the patient can try to rephrase their answer. So there's empathy here. It can be challenging to put this into words. Then there's reassurance. You're doing a great job. I'm here to listen. Can you please rephrase, or could you try explaining it in a different way? Then another exercise. How will you respond to this patient? Is this surgery really necessary? Is there no other alternative? You have to use reflection to interpret the patient's emotion and then respond reassuringly. How can you do this? What do you think is the patient's emotion when they ask, is this surgery really necessary? What would be the patient's emotion here? We just have to convey that using reflection, that it sounds like you are your concern is genuine. Okay, anxious and nervous. Very good, very good. Yes, you're absolutely right. So let's see the answer suggestion. Sounds like you're feeling very anxious about your surgery. Is there anything particular that's making you feel this way? Let's talk through some strategies to help you manage your anxiety. So this response shows reflection because it is reflecting on the patient's emotions, that is concern, anxiety, nervousness. And then again, for reassurance, the health professional offers a solution-focused response so that the patient feels reassured that, okay, you're going to help them talk through the strategies to manage this anxiety. If they have any concerns, you can assuage those by responding to the questions and offering some solutions that would make them comfortable. Okay, we come to the fourth section that would be using clarifying statements that are vague or need amplification. Before we move on to this section, do you have any questions about what we've discussed so far? So I think there was a question by Estrella. I'm just going to move up and see. All right, I don't see any questions at the moment. If there are any questions that you have about the three sections we've discussed, please put them down here in chat. I will, once we complete our fourth section, then we would address any questions that you have. Great. So this section is about clarifying anything that is vague or needs elaboration by the patient. So sometimes patients might say something that isn't complete or doesn't completely define what it is that they want to say. So something that is unclear. And clarification at that point is, of course, extremely necessary. For example, a patient might say that they feel sick, which could mean a variety of things, such as nausea, headache, fever, body aches. So to accurately diagnose and treat the patient, obviously you will need to clarify and understand the patient's specific symptoms. So sometimes a patient might use words which could have a variety of meanings. The interpretation could be very different for different people. So in those cases, it's best to check that what is it exactly that you mean. As a health professional also, it is better that you clarify your instructions. So for example, take this medication twice a day. It can be further clarified for the patient. Take one pill in the morning, one in the evening, approximately 12 hours apart. The second instruction is more clear. It's clearer than the first one, right? So to avoid any patient misunderstanding or misinterpretation, it is best that when you give your instructions to the patient, you clarify it as much as possible. Let's see some examples. If the patient says, I don't feel good, now I don't feel good, this is very vague, it's ambiguous, right? You can probe into it further. So can you describe what you mean by not feeling good? Encourage the patient to talk more. So you understand why is it, what is it exactly, what is it precisely that's bothering them. I'll see the second example. I'm feeling really down. Now again, it could mean different things for different people. So you can clarify by saying something. Can you tell me more about your mood? Or can you tell me more about how you're feeling? Okay, now we have 5 examples here, but we're running a little late behind schedule. So I would like you to clarify just the first 2 statements that you see on screen. If a patient says, I've been feeling so worn out lately, how would you clarify this sentence? Great, lovely, lovely. From a better understanding, please tell me more about it. What's bothering you? Can you tell me what you mean by worn out? What makes you feel that way? Sundari, this is a great example. Great, lovely. And how about the second one? How would you clarify if a patient says, I exercise every other day? Is this clear enough? Or if not, how would you clarify this? Fantastic examples for the first one. Lovely. Come to the second one. How would you clarify I exercise every other day? If you feel this is somewhat vague, what sort of clarifying question would you use to make this clearer? How many days apart, please? Okay. Could you tell me what you mean by this, right? Very good, Sundari. Do you mean every alternate day? Wonderful, Meenakshi. Great. Good, Aliza. All right, we can see the answers now. Of course, these are just one answer suggestion. We saw some lovely examples in the comments, and there's more than one way to clarify, of course. So this is just one way clarification will be done for these statements. So I've been feeling so worn out lately. Can you tell me a bit more about what you mean by worn out? Then if a patient says, I feel I'm carrying the weight of the world on my shoulders. Do you mean you feel overwhelmed with too many things to do? I think I missed the answer for the exercise example. So for that, I exercise every other day. So for this, you could clarify, could you tell me by this, do you mean every alternate day? That's one of the ways you clarify. Then it's like I'm seeing everything in a new light. Can you tell me more about why you feel like that? My stomach never feels right. I'm not sure I understood that completely. What's another way you might put this? So the last example, the last answer suggestion that you see, I think that's something that could work pretty much in all situations when you want to clarify something that I'm not sure I understood that completely, or I'm afraid I didn't understand that. Could you rephrase it, please? Or what's another way you might put it? And that brings us to the end of section 4. And we come to the final technique, which is summarizing. Now, summarizing is basically providing explicit verbal summary to the patient. And there are 2 kinds of summary you will use in your role play or in your medical consultations. internal summary and end summary. So internal summary is something that focuses on a specific part of the interview. Now, the way I see it, one summary could be after your information gathering stage. Another one could be after your information giving stage, right? And then there is an end summary, which concisely pulls together the entire interview. Like, so before you wrap up, you could quickly discuss whatever you've discussed, what the outcome or the discussion of the final discussion or the action points have been for that consultation. So in information gathering stage, once you've gathered all the information, at that time you should summarize whatever you've understood to ensure, one, that whatever you've understood is accurate. Number two, to make sure that there is nothing left. There's something that the patient hasn't missed sharing with you, right? So let's see an example. You see a dialogue between a patient and a health professional on the screen, and the section that has been highlighted in green is how the health professional summarizes. So I'll give you some time to read this. So see, in this example, first the patient shares that they've had trouble sleeping, they wake up a few times in the middle of the night, then they have trouble falling back asleep again. And they also feel tired during the day. Then in response to the health professional's question, they share that they've been stressed at work, have had increased working hours, and have increased their consumption of coffee. So the health professional summarizes everything. So just to summarize, you've been having trouble sleeping and feeling tired. You've also been stressed at work, working long hours, and drinking more coffee than usual. Is that correct? Now, what I would like you to see is, one, see the signposting to indicate that the health professional is going to summarize. Now, signposting, for those of you who are not aware of what this is just indicating what you're going to talk about. That's what we call signposting. So see this example. Can I check that I've understood what you said correctly? This indicates to the patient that now you're going to summarize whatever you've understood till that stage, till that point. And then after summary, you are deliberately checking. You're asking, did I miss anything? Or is that correct? And this is something that you must do when you're summarizing. Always use a signposting phrase to indicate that now you're going to summarize. And then once you've done that, then check for its accuracy. Let's see some examples that you can use to signpost. Let me make sure I've understood correctly. And then you summarize. Just to summarize what you've told me so far, if I'm hearing you correctly, so to clarify what you've said, from what I've understood, so if I may recap what you just said, to recap what you've told me, just to review, let me see if I've got this right. From what you've told me, I gather that. So all of these are examples of signposting phrases that you can use before you share your summary, before you summarize to the patient. And then how can you check for accuracy after summarizing? Did I get that right? Is that an accurate summary? Have I missed anything? Does that cover everything? Would you like to add anything else? Is there anything that I've overlooked? Have I left out any important details? Can you confirm if I've understood you correctly? So these are some examples that you can use. I also have a section on some helpful tips that will enhance your performance in the information gathering. Before I do that, are there any questions that I can answer? Yes, Christine, it's recorded and you can replay it. Once the class is finished, you can replay it anytime on the same page itself. So Shivani, is it important to complete the whole task? No, Shivani. So see, the role plays are designed in a way that if you plan it well and if you do it well, it will come to a natural end at the 5-minute mark. But even if you don't, as long as the examiners get an accessible section, if you miss the last task or if you're not able to complete it, it will not impact your score. So shall we move on to the helpful tips? Okay, we've discussed 5 techniques that you must use when you're gathering information. Before questioning, before you commence your questioning, it's always a good idea to seek the patient's consent and explain the rationale behind the line of questioning. This is a way of conveying respect for your patient. To be respectful and courteous towards your patient, it will also again improve the trust and rapport. So there are some examples on the screen that you see of how you can do this. Since we haven't met before, it'll help me to learn something about your medical history. Can we do that now? I'm going to ask you some questions to get a better understanding of your health today, so I can provide you with the best possible care. May I proceed? I understand that this may be a sensitive topic for you. Now, this is to be used when you are going to ask questions on a topic that is sensitive or that the patient might perceive embarrassing to talk about. So I understand that this is a sensitive topic for you, but for me to provide the best possible care, I need to ask you some questions. Is that all right? I want to make sure that I have a complete understanding of your condition. So may I ask some questions that might seem intrusive, but are important for me to know? May I proceed? It's important that we talk about your symptoms and medical history to develop an accurate treatment plan. Is that okay? So this is how you can seek the patient's permission before you proceed. And obviously this will make them feel more comfortable. And when you're interacting on sensitive topics, or even otherwise, assure the patient of confidentiality. But I know these questions are uncomfortable to answer, but let me assure you, your privacy and your confidentiality are of utmost importance to me. I understand that sharing personal information can be difficult. Please know everything that you share with me will be kept completely confidential. I'm committed to maintaining confidentiality and respecting your privacy. It won't be disclosed to anyone. Then after you have gathered information and after you've summarized as well, as a sign of courtesy, thank the patient for cooperating with you. So some examples of how you can do that. I appreciate your willingness to share this information with me. Thank you for telling me what you've been feeling. Helps me to understand the situation much better. Thank you for taking the time to provide me with this information. I want to thank you for sharing your concerns with me. I value your participation in this process. And one final tip, whenever you are gathering information, when you're asking questions on a topic that's sensitive or somewhat embarrassing for the patient to talk about, you can soften the questions by a technique called hedging. And how we do this is we prefix a phrase like what you see on the screen, these examples. So we prefix this to our question to soften it, to make it politer, to make it sound less intrusive. So these are some of the phrases that you can use. Would you mind telling me about? Would you please tell me? Can I ask? I'm wondering if you can tell me something about. So instead of asking a question on a sensitive topic directly, like this one, have you ever been pregnant? It would be better to soften it. And how we can do that? Can you tell me if you've ever been pregnant? Or see the second example. What steps have you taken to lose weight in the past? May I ask what steps you've taken to lose weight in the past? So what did we do to make it indirect or to just soften the question? We added this phrase here. May I ask? And in the first example, can you tell me? In the third one, the direct question is, when did you first notice blood in your stool? So we transformed it by adding this phrase. Can I ask when you first noticed blood in your stool? So this is to be used when it's a sensitive topic and you want to make the patient feel comfortable. All right, with that, we come to the end of this class. I'll give you some time to ask me any questions that you may have about what we've discussed today. Estrella, yes, the tone should always be professional. Okay, that's a good question, Reginald. If I'm sorry if my pronunciation is not on point. So do we do that in all scenarios? See, when you are gathering information, it's a good idea to take the patient's consent, right? I mean, in all scenarios, there could be some scenarios where your role play starts after an examination, right? So in that case, you wouldn't need to do this. But yeah, when you are gathering information, so like I said in the beginning, it is a task, find out or ask or inquire, which will require you to gather information about the patient's history or their symptoms. Yes, it's a good idea to take their consent, seek their permission that you're going to ask them some questions and give them a rationale. Lindsay, I wouldn't advise that. I think it's best to stick to professional tone and language. That would be much better. Okay, Aliza, about bad news. Now, that's another lesson. So if you could reach out directly, perhaps I could share a mini resource or a lesson on how you can do this. Lovely. So if there are no further questions, let's wrap up. And we're going to share a WhatsApp group link invite here in the comments. If you want to see the slides, because I said that we would be sharing handouts of these slides. It's got lots of language examples, which are actually quite useful for all the health professionals, regardless of whatever discipline you're preparing for OET for. The concepts and the language examples that we've used will be helpful in your performance. So I'm going to share the link here. I'm going to put this down in the chat itself. Please join that group, and that is where I'll share a PDF of the slides that I've used in today's class. Thank you, everyone. You've been a wonderful audience, and I hope that you found the class useful. If you're looking for OET training, please reach out to us. You can contact us through our website or via WhatsApp, and contact details would be mentioned on the second slide of this PDF.